Well, as allergy sufferers are aware, allergy season is here and the symptoms are hitting some people extra hard this year. Rich can attest to that. And for all the answers to your questions, we turn to Dr. Michael Sevilla. Good morning.
Good morning, Jeff.
Well, tell us, this is like one of the worst allergy seasons in probably the last 12 years or so. Is that right?
Yeah, I'm seeing a lot of reports across the country that the pollen counts are the highest that people have seen, not just in this area, but a lot of regions of the country. So definitely yes.
Why are so many more people being affected by allergies these days than probably, let's say, 20 years ago?
I think a lot of it is just kind of recognizing what the symptoms are, and there's a lot of good treatments out there right now to treat some of this stuff. And we're learning a lot more, not just grass and trees and pollen, but animals and latex and food allergies. So we're recognizing it a lot more.
What should people do if they think they are allergic? Should they get it? Should they go to the doctor, get a shot, an allergy shot? What would you suggest, I guess?
There's a lot of pretty good over-the-counter treatments right now, and even things that not even involving medications. There's a lot of things like even saltwater nasal sprays. I have a lot of my patients talk about the neti pot that they can they can wash out their nasal passages. That works pretty good. So there's a lot of things that you can try even before seeing the doctor.
And we have somebody here that in our building that attests to the neti pot, and it looks weird because it's a teapot that you just sort of pour in your nose. Is that right?
That's right. You wash out your nasal passages just with some salt water and things. And for some people swear by it, and it does really help some of their allergy symptoms.
But it doesn't help if you're real clogged. Is that right? Like if you're like clogged up, it doesn't work because it has to go somewhere. Is that right?
Yeah, what I tell people is that if you start to see that, start that right away, or use that every day or every other day. It's more of a prevention type thing, and if it's too far gone, if your symptoms are too far gone, it won't help at all.
Now, how long do we have to endure this, I guess? Any ideas, or is there any forecast, I guess, for how long we have to endure these allergies this season?
Well, the pollen season, I mean, it starts right now. I mean, right now is tree pollen season, and you can see there's a lot of different people that have pollen counts out there. In a few weeks, you move into grass pollen, and then more in the fall is when you have ragweed pollen. So it's going to be all spring and summer with us.
And this can really be detrimental to some people. I mean, some people get it worse than others. What do you tell those people, I mean, who are affected so bad by these things? I mean, is there some relief, like Rich, who is losing his voice throughout the morning? Is there some relief out there that he can take right now to help that out with the voice and stuff?
Well, I mean, the good thing is to try some over-the-counter medicines, but people who have more severe type symptoms may need to get formal allergy testing or even allergy shots, and those are treatments that we use when symptoms are a little bit more severe.
All right, Dr. Sevilla, we'll be interested to see what else you have to say coming up in our next hour, because I'm sure a lot of people are feeling the pain of the allergies this year. Thank you very much.
Okay, thanks.